Hi all, I am Dr. Malati working as a professor in Tripoli College of Nursing. So in this video I am going to discuss about the amniotic fluid. The objectives are introduction, definition, purposes, constituents, source, volume, interpretation, clinical assessment and diagnostic, color abnormalities and nursing management, summary and conclusion. Introduction. Amniotic fluid is the clear fluid that surrounds and protects the fetus inside the amniotic sac during pregnancy. So it begins forming early in pregnancy and increases in amount as the fetus grows. The normal amniotic fluid is essential for healthy fetal development and also for the safe pregnancy. This is the image, USG image of amniotic fluid. Definition. Amniotic fluid, it is also known as liquor amni. It is a fluid which distances the amniotic sac and also allows the fetus for the growth and free movement. The purposes are, it equalizes the pressure and protects the fetus from jarring, which means sudden vibration and injury. Unknowingly, if a mother fell down, means it protects the fetus. Then the fluid maintains the temperature for the fetus and also it provides small amount of nutrients. In labor, it aids in effacement of the cervix as well as the dilatation of the cervicals. As long as the membranes are intact, the amniotic fluid protects the placenta, umbilical cord from pressure of the uterine contractions. It also allows for the growth and free movement of the fetus. The constituents are the things which is present in the amniotic fluid. So when you look into this amniotic fluid, it is a clear, pale, straw colored fluid which is consisting of 99% of water only. The remaining 1% it is dissolved in solid matter including food substances and also the waste products. It contains, means within this 1% it contains fetal urine, respiratory tract secretions, skin cells sheds by the fetus, vernix caseosa and lamito. Sources of amniotic fluid. It comes from both maternal side as well as the fetal side. Some fluid is exuded from maternal vessels in the decidua and some from fetal vessels in the placenta. It is also secreted by the amnion and the umbilical cord. So amnion is a membrane which covers the fetal surface. Then the fetal urine also contributes to the volume from the 10th week of gestation. Volume. Volume of amniotic fluid increases throughout the pregnancy gradually. At 38 weeks, it is about 1 liter, that is 1000 ml. It diminishes slightly and at term, the amount is about 800 ml. Interpretations are, if the total amount exceeds 1500 ml, the condition is termed as polyhydramnios, and if the fluid goes less than 300 ml, it is termed as oligohydramnios. Clinical assessment and diagnostic. Here we can able to identify the amniotic fluid index through ultrasound. This AFI, which is otherwise called as maximum vertical packet. So through USG, we can able to identify the AFI by dividing the amniotic fluid sac into 4 quadrants. So each quadrant consisting of 5 centimeter. So totally it comes around 20 centimeters. So if the range, which means the normal range should falls between 8 to 18 centimeter. When it goes less than 8 centimeter, we will call it as oligohydramnios, and when it goes above 18 centimeter, it is termed as a polyhydramnios. And another investigation where we can able to do with this amniotic fluid is we can able to find out the genetic abnormalities through the procedure called amniocentesis. So by this we can withdraw the amniotic fluid and this fluid can be sent for the laboratory to detect the genetic abnormalities and also surfactant studies. Color abnormalities. Green color indicates meconium staining, which is nothing but fetal distress. Golden color indicates RH incompatibility, bilirubin level elevated. Then dark brown and tobacco color indicates intrauterine fetal death. Nursing management, monitor AFI during antenatal checkup, and also as nurses we are supposed to educate about the kick counts, especially if a mother is having a oligohydramnios. Then if a mother is undergoing a procedure called aminosynthesis, we are supposed to do the pre-procedure and post-procedure care. Monitor for fetal distress during the rupture of membrane by checking a FHR. Summary: amniotic fluid is the clear fluid surrounding the fetus inside the amniotic sac. It is essential for fetal protection, temperature regulation, free movement, and lung development. The volume increases with gestational age and it is an important indicator of fetal well-being. Conclusion: adequate amniotic fluid is vital for a healthy pregnancy. Regular antenatal assessment helps in early detection of abnormalities like oligohydramnios and polyhydramnios, ensuring better maternal and fetal outcomes. References. Thank you.